Hey there, my name is Karen Rathgeber and I am an occupational therapist with over 30 years of experience. I was asked to share my perspective on the article titled, "What is the Value of Occupational Therapy in Return to Work for Breast Cancer Patients?" I also want to share my own clinical experiences with the rehabilitation of both men and women following breast reconstruction. As an OT, I focus on returning the client to productive living, whether it's as basic as caring for themselves or more advanced such as returning to work. In other words, what occupied their time to feel like a valued member of their community. This could mean return to learning, return to parenting, return to playing, or working. But ultimately return to what gave them a sense of purpose. As an occupational therapist, that is always the goal, to bring the patient back to where they were prior to the injury or their illness. In this particular article, the authors comment on the reasons why the focus of treatment does not include return to work. In Belgium, socialized medicine provides limited financial support, which in turn leads to a lack of expertise in clinicians. However, we can sense several similarities within our own country. When clients undergo breast removal, radiation, and/or chemotherapy, residual effects often cause physical problems due to pain, decreased movement, and poor endurance. In my experience, these physical limitations tend to be the primary focus of rehab. Everyone's ultimate goal claims to focus on the return to a full and meaningful life. However, that oftentimes equates to just good enough for them to regain strength and endurance to return home. But is that all we want for these men and women? Often overlooked are the issues that really hinder the person's return to a productive lifestyle. Memory loss, difficulty problem solving, irritability, frustration, and social isolation are a few issues that create an ongoing cycle of emotional, physical, and cognitive difficulties. Even though clinicians want to focus on survival aftermath, are we always supported by the insurance companies to reach the ultimate goal of productive living? According to the article, there's an increased number of men and women under the age of 50 who have difficulty participating because of these residual effects from breast cancer. Have we adopted the mentality that these men and women are seen as breast cancer victims? This breast cancer survivor mentality should include transition to a productive and active lifestyle, which includes return to work and return to play. We, as the facilitators of health and wellness, should not set our goals on just surviving, but focus on the ultimate goal of productive and active living. Thank you so much for listening.